Hi, I am Dr. Manoj Gulhane. I am a neurologist and epileptologist practicing in Nasik for last 22 years. I have my special interest in epilepsy other than the remaining disorders of neurology. I had done my training from MD medicine and the degree of doctorate in medicine in the branch of neurology from Mumbai University in 1993. I want to pass a message which touches my heart and which is very important for the population regarding one common neurological problem, that is of epilepsy. Somehow this problem is looked down. The patients who have epilepsy, they are not treated equally in the society, and they always people carry some grudge about that. We have been doing a lot of work on this issue to take this grudge out of the society about epileptic patients. As the medical science has advanced, the treatment of epilepsy is becoming simpler, more economical, and very easily manageable at various places. Maybe 25 years back there were not many neurologists, but now you have good neurologists available in all the corners of the country. So the epileptic patient should contact the doctor properly. I won't call it a disease. Epilepsy is something like abnormal episodic electrical dysfunction of the brain, where the brain cells fire off excessive electricity and patient loses his consciousness. There is stretching of the hand, there is tonic-clonic movements of the body, the eyes gets uprolled up, and there is froth at the mouth, and there may be a tongue bite. This is a common description of generalized epilepsy. Then there are various types of epilepsy, let us start from the childhood. In pediatric age group, there is one common epilepsy type is absence attack, in which the child just stops doing anything and his eyes flutter like anything at the frequency of 3 per second. The child drops the things in hand and within few seconds he never falls, and within few seconds he becomes normal. This is absence attack. Similarly, another very common epilepsy in childhood and adolescent age is myoclonic epilepsy. This is also called a juvenile myoclonic epilepsy. The patients in their teenage, they typically get the convulsion attack on getting up in the morning or early in the morning. These two types of epilepsies are easily controlled after EEG, that is the brain electrical graph. Necessary investigations like CT scan or MRI. The safest drug which is used is sodium valproate, which is very well available and known by so many pharmacists and doctors, available in absolutely small towns as well. The other type of epilepsy which are focal, that means one part of the body, either right or left, start jerking and then the patient becomes normal after some time. In epilepsy, certain investigations are required, that is one, as already told, like electroencephalogram, which is a graphic representation of the electrical activity of the brain. Then there is the investigations like mainly CT scan and MRI, which sometimes show the causes of epilepsy as some infections in the brain like tuberculosis or neurocysticercosis. And then there are certain important things also can be picked up which can be dangerous in the life, like brain tumors. Brain tumors always cause epileptic attack, fit attack first than the headache. Usually the concept in people that brain tumor will cause headache first, it is wrong, it is not true. It will cause epileptic convulsion first. Headache comes virtually at the last time of in the brain tumor progression. So investigations like CT scan, EEG and MRI, they are absolutely necessary, and sometimes we advise blood tests like sugar, calcium, magnesium, because if calcium and magnesium are low, then the person can get epileptic convulsions. The epileptic convulsion can also happen because of severe CNS neurological infections like meningitis, which is bacterial or tuberculous or viral. So that is also to be taken into consideration whenever you go to the neurologist. Then the last type of epilepsy, which is being treated very successfully by something called as epilepsy surgery. There are certain types of epilepsies and there are certain types of MRI finding in those patients, like a part of brain which is important, mesial, it's a temporal lobe, and hippocampus of the brain, where we find some childhood trauma has caused the dysfunction of that part of the brain of the antetemporal lobe or hippocampus or medial temporal lobe. These patients usually have a severe type of epilepsy which requires many drugs. But now with the advances of the science and the surgical team, we can operate them upon and we can stop their medicines for epilepsy successfully over a couple of years after the surgery. So the patient becomes epilepsy free as well as drug free. If there is a brain tumor, unfortunately, one has to go for the surgery, followed by, sometimes if it is cancerous, then they have to go for chemotherapy and radiotherapy. Coming to the drugs, way back there were very few drugs available in 1975 to 80, only like Gardinal, what we call, or phenobarbital and phenytoin sodium. They had honestly quite a few side effects, but we didn't have a choice but to give them because the medicine had not progressed. But now we have a certain huge array of medicines. You take levetiracetam, you take sodium valproate, you take carbamazepine, eslicarbamazepine, and now lacosamide, lamotrigine, perampanel. So these are all new third and fourth generation epileptics. Just to compare, like when 25-30 years back we had only Fiat cars, then Maruti came, and then the technology of even automobile industry and all the industries improved, and now we have very good safety cars. Similarly, now we have a lot of safe medicines available for epilepsy. There are certain do's and don'ts for epileptic patients. They should not drive at least for the first 3 months after the first conversion, and if their neurologist certifies that okay, your epilepsy is quite well controlled, and then you can drive. Swimming is always to be avoided. The reason is that unfortunately you get an attack in the swimming pool, then it can be even fatal. Swimming can be done only in presence of trained expertise and somebody from the family which is around the swimming pool. Third thing, going at the heights, going near the fire, or for an industrial worker working near a huge mobile machines and motors can be dangerous sometimes. The second point is a good sleep hygiene. All the epileptic patients should see to that they have a proper night sleep, at least of 8 hours. Because if sleep is less or they have late nights, then even if the drugs are going on, they may get a conversion. Coming to alcohol. Alcohol once in a while in moderation can be allowed with epileptic patient. This is being asked to us quite frequently, but unfortunately we have to say yes sometimes for the social reasons. Never to miss a drug. is a dictum of epilepsy patient. Like patients of hypertension, diabetes, they have to take regular treatment. Similarly, the epileptic patient should take proper dosing of the drugs which they have been prescribed. If you miss a drug even for a day, you might get a conversion again, and the treatment will go up for 3 to 5 years again. Coming back to certain types of epilepsy, usually the focal epilepsies or idiopathic generalized epilepsy, they require treatment anywhere from 3 to 5 years. If it is a systemic epilepsy syndrome, like a conversion after brain hemorrhage, a conversion after head injury, they may require a very short-term treatment of 3 to 6 months of antiepileptic and not a long-term treatment. Around 30% of the epileptic patients, those who have particularly myoclonic epilepsy, they may require lifetime treatment. That is, this patient needs to be counseled well, segregated well, and treated well. Coming to drug side effect, yes, all these are chemicals. There are certain side effects to particular drugs, like the commonest being used is sodium valproate. It has side effects of weight gain, hair loss, tremors in the hand, and in women particularly weight gain and polycystic ovarian disease. So your doctor has to be careful in monitoring this. Drugs like carbamazepine, which is popularly known as Tegretol, Zeptol, Zane in the market, they can cause a skin rash, similarly lamotrigine as well. The drug like levetiracetam, which is very popularly used all over the world, is otherwise a fairly safe antiepileptic, but as the time is going on, we find certain behavioral abnormalities in the patient, like they become restless and fidgety.